Hey friends, Dr. Christy here. So something came up with a patient today that I wanted to share. Thought it would be valuable for you. People tend to go on elimination diets frequently when they're trying to see if a certain food is impacting them negatively. So I've talked about this once before, right? Sometimes people will eliminate gluten, for instance, or dairy, or corn, or something like that, or all of it for a while. See how they feel, and then slowly, one thing at a time, reintroduce those foods back in and see how their body responds. We can do the same thing in the opposite kind of direction with our supplements. So frequently, I'll have patients ask me, do I really need to be taking all of these supplements? Or, well, I did something bad today. I did something bad this week. I stopped all my supplements. I say, great, good for you. How did you feel? Because it's really helpful sometimes to actually give our bodies a break of all the things that we're taking on a regular basis. So for instance, that probiotic you take, that magnesium you take, the multivitamin, your B vitamin, whatever things you take, it's sometimes really good to take a break off those things and see how your body responds, just like an elimination diet, but in reverse. So you take those things away from you and see if you feel worse. If you don't feel worse, then maybe those things weren't necessary. Or if you do feel a little bit worse, then maybe you bring those things back in one at a time, slowly, to see which things are having the most impact for you in a positive way. So I always recommend, it's actually a really good idea sometimes to get off all supplements, give your body a break, and then reevaluate and see what's really necessary, and go from there to determine what your body needs to fully and completely optimally thrive. Because sometimes things change over time. I've had patients who are on the same probiotic for like 6 months or longer sometimes, and then they take it away and they're like, well, yeah, nothing really changed. I feel pretty good. Now, probiotics, I do tend to recommend them most of the time for most people, but not all people, not all of the time, and certainly not the same type. So explore this with yourself. If you're interested and you generally feel pretty good most of the time, but you take like 16 supplements or something, you may not need all of them. Play with it a little bit and see how your body does. If you got any questions, drop them below, and talk to you soon. Have a good day.